Hi, my name is Rachel Stewart. This is my head-to-toe physical assessment video for Maryville University. This is Terry Paris, my best friend, who has agreed to be our patient for this video. Before we began, I had Terry empty her bladder. She put on the gown. We measured her height, weight, full set of vital signs. I have washed my hands, and we have checked Terry's near vision with the Rosenbaum chart and distant vision with the Snellen chart, and we are now ready to begin with the exam. We're going to begin the exam with the inspection of the head, making sure the head is midline. We are going to palpate the skull, making sure it's normal cephalic, that there is no masses or areas of tenderness. We're also going to palpate the hair while we're here, noting the texture of the hair distribution, that there's no areas of alopecia, and that the hair follicles are not easily removed when we run our fingers through the hair. Next, we're going to palpate the facial bones, noting for any masses or areas of tenderness. We're going to palpate the frontal sinuses and the maxillary sinuses. Any pressure to these areas?
No.
Okay. Next, I'm going to have you open and close your mouth. We're going to assess the temporal mandibular joints, checking for popping, clicking, or pain. Any pain with that activity?
No.
Next, we're going to check Terry's cranial nerves. I'm going to ask her to put her face through a series of motions, and while she does this, I'm going to be assessing her face for symmetry. Terry, if you will puff your cheeks, clench your teeth, smile, stick out your tongue, move it side to side, close your eyes tight, wrinkle your forehead. Next, I'm going to touch you with a Q-tip. I just want you to let me know if you feel the sensations equally on both sides. If you'll close your eyes to your forehead, can you feel that even on both sides? To your cheeks, can you feel that even on both sides?
Yes.
And your chin, can you feel that even on both sides?
Yes.
Okay. Now we're ready to move to the assessment of your ears. Excuse me, we're gonna first do the eyes. We're gonna assess the eyes for positioning and placement. We're going to assess the hair distribution of the eyebrows and the eyelashes. The eyebrows should be full. The eyelashes should extend outward. We are going to palpate the lacrimal apparatus. We are going to inspect the sclera and the conjunctiva. Conjunctiva should be nice and pink. Next, I'm going to have you look at a point on the wall. Cover your left eye. Uncover. Cover your right eye. And uncover. While Terry's completing that, I'm observing her eyes for any extraocular movement, any jerking, or nystagmus. Next, we're going to check the cardinal fields of gaze. Using your eyes to follow my pen light and not moving your head, just follow this light. Again, I'm observing Terry's ocular movement, making sure the movements are nice, smooth, with no jerking or areas of nystagmus. Next, I'm going to check your pupillary response, both direct, looking at the pupil that the light's shining the eye in, and consensual, looking at the opposite pupil. Direct and consensual. Now we're going to check confrontation. You'll cover your left eye. I'm going to cover my right eye, and just let me know when my finger gets in your field of gaze.
No. No. No.
Let's switch.
No. No. No.
Okay. Now we're going to move to the assessment of your ears. We're going to assess for the positioning and placement of the ears. We're going to palpate the auricle, noting it's nice and smooth. No lesions, masses, or areas of tenderness. I'm going to walk behind you, whisper a word, and just let me know what I've said.
Apple.
Orange.
Orange.
Okay. Next, we're going to complete the Weber test. I'm going to strike the tuning fork, place it in the center of your head, and just let me know if you hear the sensations in the left ear, the right ear, or both ears equally.
Both.
And for the Ren test, we're going to strike the tuning fork, put it on your mastoid process. Just let me know when you're unable to hear the sound.
Now.
And when you're unable to hear the sound.
Now.
Okay. Next, we're going to move to your assessment of your nose. We're going to assess for the positioning of your nose, that your nose is midline. We're going to assess the internal structures of the nose, looking at the nasal turbinates. The nasal mucosa should be moist and pink. There should be even hair distribution inside of the nose. And the nasal septum should be midline and not deviated. Next, we're going to move, now we're going to occlude one of the nostrils. If you'll occlude one nostril, take a deep breath. Okay, repeat that on the opposite side. Any problems breathing with those two tasks?
No.
Okay, next we're going to assess the mouth. We're going to assess Terry's lips to make sure they're nice, moist, pink, and plush, that there's no areas of cracks or fissures. Also in the corner of the mouth, that there's no cracks or fissures. We're going to assess Terry's gums to make sure they're pink, non-recessed, and not bleeding. And we're going to assess Terry's teeth for the color, the quantity, any broken teeth, missing teeth, or visible cavities. So we're going to do that now. We're also assessing the tongue on both the left and right side. Terry, if you'll turn your tongue to the left, looking at the lateral side, and the right, looking at the lateral side, and pick your tongue up, looking at the floor of the mouth. Okay, you can relax your tongue. We're going to look at the buccal mucosa, the hard palate, the soft palate, the anterior posterior pillars, the uvula, the tonsils. Now I'm just going to get you to say ah,
Ah.
and then we're going to check for gag reflex. Okay. Now we're going to inspect the neck, looking at the neck's placement. We're going to inspect for any JVD, which there is none noted. We're going to assess for the presence of a goiter or any active pulsations, which there are none. We're going to ensure that the trachea is midline. Now we're ready to palpate. I'm going to palpate the trachea to ensure that it's midline. We're going to palpate the thyroid gland, pushing it slightly over to the right. Terry, will you swallow? Making sure the thyroid feels smooth. Now we are going to palpate the carotid pulses, one at a time. We're also going to palpate the lymph nodes, preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical chain, posterior cervical, deep cervical, and supraclavicular. Now, will you please put your ear to your shoulder and on the opposite side, and your chin to your chest, and tilt your head backwards. Now, shrug your shoulders. Now we're going to repeat all those activities, and I'm going to apply resistance this time. Put your head back and shrug your shoulders. Okay. Now we are going to auscultate both the carotids and the thyroid, both with the bell of the stethoscope. To auscultate the carotids, if you'll just hold your breath for me. And now I'm going to auscultate the thyroid gland. Okay. Now we're ready to move to the assessment of the shoulders, arms, and hands. I'm going to be inspecting and palpating the skin for the musculature, the temperature, the color, and the hair distribution along the arms. I'm going to inspect the hands for the nails. The nail beds are all intact, that the nail beds are pink with no cyanosis. There's no clubbing of the fingers. Cap refill to the fingers is all brisk, less than 3 seconds. We're going to palpate the brachial pulses and the radial pulses noting both intensity and amplitude. Next, we're ready to inspect the back. If you'll turn around for me. We're going to inspect the skin on the back, that there's no lesions, masses, no breaks in the skin integrity. We're going to assess her respiratory rate and rhythm. The rate is 18 or less. The rhythm is non-labored with symmetrical chest rise and fall. We're going to inspect, palpate, and percuss costovertebral angle with indirect percussion that should not elicit any pain. We're also going to inspect thoracic configuration, noting the anterior to posterior diameter is 1 to 2. Next, we are going to check expansion, placing my hands at the level of the 10th rib. Terry taking a big deep breath and release. And I'm just watching to make sure that the movement of my hands is symmetrical with her chest. Now we are going to palpate tactile fremitus. Terry, when I put my hands on you, I just want you to say 99. First with the palmar aspect.
99, 99, 99, 99,
And over.
99, 99, 99, 99.
Next, we're going to percuss systematically in between the intercostal spaces, and we should hear resonant sounds. Okay, put your arms above your head for me. Assess the lateral sides. Okay. Next, we're going to check for diaphragmatic excursion. Terry, if you will cross your arms and put them in front of your chest and lean forward ever slightly. Okay, and go ahead and get the highlighter and hold your breath for me. Okay, I'm going to mark this area where the sounds changed. Now, Terry, release your breath. Taking a couple, about 3 breaths. On the 3rd breath, I want you to fully exhale and then hold the breath. We're going to mark that side where the sound has changed again. And the normal finding should be about 3 to 5 centimeters here. Normally this will be done on both sides, but for the lack of time for this video, we're only going to do one side. Next, we're going to move to auscultation. We're going to systematically auscultate the lung sounds. You're taking some breaths for me, Terry. Using the diaphragm of my stethoscope, moving systematically. Should hear nice, clear lung sounds. No adventitious noises. Okay, if you'll put your arms above your head, we're going to listen to the laterals. Comparing on each side. Okay. If you'll turn around for me. We're going to continue with the auscultation of the lung sounds on the anterior chest. Moving systematically. Noting clear breath sounds. Next, we're going to do a general inspection of the anterior chest wall. I'm going to note Terry's respiratory rate, effort, and rhythm. The rate should be 18 or less. The rhythm should have symmetrical chest rise and fall, no increased work of breathing, no nasal flaring, no accessory muscle use. We're also going to assess the skin on the anterior chest. It should be pink, warm, and dry with no cyanosis, no diaphoresis. We're also going to inspect the precordium for any heaves or lifts. Now we're going to palpate the precordium, palpating the apex, the left sternal border, the base, and the apical pulse. And while we're palpating these areas, I'm allowing the cardiac movements to rise to my hand. I am palpating for heaves, lifts, or thrills. Also during palpation, I'm going to palpate the anterior chest wall, noting for any areas of tenderness or masses. Additionally, we're going to palpate the infraclavicular nodes and the axillary nodes. Okay. Also, during palpation, we're going to repeat the tactile fremitus. Again, as we did on the back, if you'll just, when you feel my hands touch you, just say 99 again.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, we're going to systematically percuss between the intercostal spaces again, hearing resonant sounds. Moving systematically across the anterior chest. Now we're ready to auscultate the cardiac sounds. First with the diaphragm, and then with the bell of the stethoscope. We're going to listen to aortic, pulmonic, Erb's point, tricuspid, and mitral. Again with the bell. Okay, and I'd like to listen to that while you're laying on your left side, so if you could do that for me. Perfect. Now while you're laying down, we're going to assess your abdomen. You'll lay flat on your back for me. I'm going to go around the opposite side of the bed. Approach you on your right side. Okay. First, we're going to do a general inspection of the abdomen. Keeping you covered. We're going to use tangential lighting, looking horizontally on the abdomen for the characteristics, the contour, which yours is nice and flat, any pulsations or extra movements. Now we're going to move to auscultation. With the diaphragm of the stethoscope, we're going to begin with the left lower quadrant, listening for bowel sounds. We will listen to each area up to 2 minutes, noting for bowel sounds. And if a certain area we're unable to auscultate bowel sounds up to 2 minutes, we'll stay in that area for up to 5 minutes. Then moving to the bell of the stethoscope, we're going to auscultate the aorta, the left renal artery, the right renal artery, left iliac, left femoral, and right femoral. Okay. Now we're going to auscultate, we're going to percuss the abdomen, moving systematically. We should hear timpani over air-filled areas and dull sounds over organs. Next, we're going to percuss the liver border on the right midclavicular line. I'm going to percuss down till we hear that sound change. Mark that area and then percuss up. Hear a nice dull sound. Normal should be about 6 to 12 centimeters. Terry, will you turn on to your side? We're going to percuss the spleen. We're going to do left mid-axillary line about the level of the 6th rib. Okay, hold your breath. Okay, go ahead and lay back. Now we're going to systematically do light palpation over the abdomen, palpating for the abdominal organs, any masses or areas of tenderness. Now we're going to do some deep palpation, palpating for the same. Now, on the right costal margin, we're going to do some deep palpation to palpate the liver border. On the opposite side, to palpate the spleen, which we should be unable to palpate. While we're here, we're going to palpate the left kidney and the right kidney. Right here, if you'll lean up ever so slightly, we're going to palpate the abdominal muscles. Okay, and then lay back. Just going to palpate the aorta, noting for any pulsations. Okay, now we're ready to move to the assessment of the legs and feet. We're going to be assessing them for skin color. I can't see, hold on. Skin color, skin temperature, skin that's intact, muscle tone, muscle mass, hair distribution along the legs, presence or in Terry's case, absence of any edema. We're also going to check the capillary refill of the toes, noting that it is brisk, less than 3 seconds to both feet. Now we are going to palpate some pulses. We're going to palpate the popliteal pulses, noting amplitude, rate, and rhythm. Posterior tibial and dorsalis pedis. Okay, if you'll sit forward for me. Swing the legs to the side of the head. Now we're going to test for strength. Put your arms out in front of you. Just going to push down. I want you to resist. And I'm going to push up and resist and put your arms out. Resist and resist. Good. Now we're going to assess for your reflexes. Brachial, radial, brachial, radial, popliteal, and Achilles. Now, if you'll stand up for me. Let's see, turn to the side. We're going to palpate the spine, cervical spine. Any tenderness?
No.
I'm just making sure that the spine is midline. Okay, step backwards towards me a little bit. Now I want you to lean forward all the way down, with your arms dangling, and I'm assessing your spine for any evidence of scoliosis or kyphosis. Now one more thing we need to complete if you'll lay down on the bed. I'm going to assess for sensations of the legs. If you'll close your eyes, I'm going to touch you with an object, and I want you to tell me, is it sharp or dull?
Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp.
Okay. This concludes my head-to-toe assessment. Thank you so much for viewing.